I'm gonna do the assessment on 2-year-old, 24 months old toddler. Okay? So now I wash my hands, do the privacy curtains, and I'm introduce myself. Hi, Blue. I'm Mika. I'm gonna do the physical assessment for you. Okay, and I'm gonna get the vital sign. So, so the respiration and pulse. So you don't tell the child you're counting the respiration, but I'm gonna do the pulse. Act like I'm doing the pulse, and I count the respiration. So for 2 years old, normal respiration is between 25 and 30, and pulse should be between 70 to 110.
Okay.
Okay, you're in the range, and I'll chart that.
Very nice.
Okay, and then I'll take his vital sign for the blood pressure on the brachial,
Mm-hmm.
and I'll do that. And then for the normal blood pressure range will be it'll be 90 over 56 for the 2 years old. Okay.
Very good.
Now I'm gonna take the temperature, and for his temperature I'll do auxiliary. I don't know where my temperature goes. It's right here.
What's that called?
A monitor. I'll do this. Okay, Blue. This gonna go under your armpit and hold it tight. Okay. Oh, Blue. Hey, back up. So the temperature is 96. That's within the range. And now I'm gonna start the head to toe. So for the head, I'm gonna measure the head the measurement so I'm gonna measure his head circumference. So for the human it goes this way, but for I have a dog, so let me see.
Under his chin. He always thinks it's a muzzle.
And then, okay, I'll chart that. Okay, and now I'm gonna look at his hair, make sure he doesn't have any. I'm looking for his like if he has any lice and dryness or dandruff and rash and stuff like that. And make sure you look by the neck. That's where the lice usually nest. It's okay. Okay. And okay, that's good. And then now I'm gonna go. Oh, and then his shape of the head, and now and then I'll feel his head for the front nail. The opening is at 2 years old. It should be closed both the anterior and posterior. Posterior usually closed 2 to 3 months, so it should be closed earlier. And frontier, since it's bigger, it should be closed by 18 months. So that's good. Palpate that, and that's good. It's closed. Now I'm gonna look at his eyes.
Oh, we got a lot of storage left in this. So.
Huh? Okay. So his eyes, look at, make sure it's equal on both sides, and look at the eyes, And I'm gonna look at the reflection of it. Oh, look in the light. Okay.
Good job. Open wide.
Okay, and then see if he can follow the lights. Is it?
Mm-hmm.
It's a follow
He's-
the light.
He's not doing a good job, but
It's okay. And that's eye movement is cranial nerve 3, 4, 5, and that's what you're checking. And let me see. The pupil, if it's react to the lights, and if it's shrink, the pupil will shrink, and that's good, and that's normal.
mm-hmm.
Now I'm gonna move on to his ears. So his ears, I'll see if I'll use that tool to look and see if okay. Pull up and back to see the farther way if you can see the eardrum, and little curving is normal. And then this side too, and check and see. Okay. And any drainage, any redness, if child has an infection, ear infection, it's gonna be all red and swollen. And he's okay with that. And now I palpate around the ear, make sure it doesn't hurt. That's good. Okay, now I'm gonna check his mouth and tell him to open wide. He doesn't want to do it. So when toddler, the baby is open mouth, you count the teeth. So for 2 years old, they should be able to, they should be 4 teeth, 20 baby teeth, or maybe it's a little bit less, like 18. It'll be average. And then make sure you look tonsils, if it's swollen or not, and any abnormalities, dry mouth, or any redness, swollen, stuff like that. Okay, and now I'm gonna check his neck and look at, I'll palpate his neck and I'm looking at I'm feeling if he has a swollen gland or any mass and stuff